Welcome to this new video on anesthesia for emergency ex-lab for the Langford Academy. My name is Latifa and I'm one of the senior clinicians in veterinary anesthesia and analgesia at Langford Vet. So today we're going to talk about a safe technique in patients that need emergency ex-lab with limited stabilization availability. Just before starting to go into depth in those cases, I just want to remind you of how to tailor an anesthesia plan. I have already presented those slides in a previous video on easy cases, easy surgery for difficult cases. But just as a reminder, when you plan an anesthesia protocol, you want to consider three things: the procedure that the patient is going to go into, the pathology that he's sustaining, and the patient himself. And you can organize those considerations, thinking about what to avoid to do, what can go wrong, what must we do, and then organize those considerations according to the most likely to happen or the most important one. After that, to produce an anesthesia plan, you want to think about pre-GA investigation. Are there any that you need? The drugs that you should give or you want to give, the logistic of the procedure and regarding to the patient as well, and also the monitoring that you would need or that you have available. A bit more in depth. First, you want to identify if the patient have a disease or a condition. You want to be prepared. So if the patient needs extra tests or extra medication before you start the anesthesia, you want to make a plan with the drugs, how you're going to provide the drugs and when you're going to give those drugs. This setting is related to the timing as well. You want to organize those thoughts around pre-operative period, but also intraoperative period and post-op periods. And then you want to establish which monitoring you want and which one you have available. You want to assess how you recognize and what signs are related to specific problems. And then you want to decide how you're going to treat. So which medication you might need, which one you have available. And when you anesthetize your patient, before you start, it's important that you're thinking, at least in your head, what's the target in intervention. For instance, patients under GA often become hypertensive, but they can become hypertensive for different reasons. So you want to provide an algorithm on how to decide, how to know if they are hypertensive, what's your limit for hypertension, for instance, and what you're going to do about it. Same for nociception and hyperventilation. So the next video, we're going to talk about Dilly Dillo the shepherd who would need to be anesthetized for a haemoabdomen. And then on a third video, we'll talk about White the cat that needs an anesthesia because he's sustaining a uroabdomen.